Hey everybody, so I got my DVD this morning, and so what I'm showing you is on the left side. This here is my PET scan from the end of October of last year, and this is my PET scan from a week ago. So that would be the second or third week of January. But so basically, my last video I talked about there was more activity in the lymph nodes, and there is, obviously there is. So this, these are your kidneys again. That's the heart, and that's the bladder, and that's the brain. That's all normal stuff. Again, that's the liver. So that looks pretty normal. Sorry. Um, but you can definitely see there's a lot more lymph node activity here, in both of these here. So it's quite a bit of stuff. I imagine that they're going to want to add chemo my next session, which is towards the end of February. But actually, no, it's middle of February. But yeah, so that's, but the good thing is that if you look down the center of the spine, um, can't really tell here, but you can see a lot of that's it's right next to the spine, and I'll show you another view later of that. But yeah, you can see as I rotate it that a lot of this stuff is just on the left side, which is really, really strange. I do have a little bit of the subclavicular lymph nodes here. Those are acting up again, and I don't think the right one over here was before. It looks like it was a little bit, but it's darker. So everything's a little darker right now, which means that they're a little more active, and that's what the report indicated, was it was more active. So we want to go through the head to toe one here. Let's see if it'll kind of give us a look at all the bits and pieces from head to toe. Right now I'm just kind of looking at the spine, and then the lymph nodes. Okay, so there's the right lymph node. There's the left lymph node, subclavicular. Another one there. Oh, there's the subpectoral that they were talking about. So that's under sub means under pectoral muscle there. It's a lot bigger than it was before, so that's interesting. And that's probably some of the other ones that you'll see in the images that look like they're in the spine, but they're really not. And then here's the pleural effusion. So it might be a little bit more or about the same as last time, but you can see there's some hot spots in there. That's probably from the pleural effusion. So again, you can see more hot spots in the pleural effusion itself, but it doesn't look like it's actually bothering the bone. It's actually in the tissue in there. And then you can see the heart muscle is just taking it more juice there. So, and that's a big spot. So I wonder if that's what's causing my left side pains. I've been having left side pain about that area, and it's probably from these nodules that are acting up and is probably causing some inflammation in there. But there's the liver, so you can see that it looks pretty uniform. There's no big, yellow blobs or anything anywhere. Those are the kidneys. That's normal. So that's more red. Well, see, here's the rib. There's a rib, and then there's no rib there. So you can see that this stuff is actually between the ribs, and it kind of explains why I'm having left side pain. So that's good to know. And there's more, I guess, for lymph nodes here. I believe that's the spleen. Don't put me on that though. All right. So anyway, it's not great, but it definitely could be a lot worse. And that's interesting. All right. So I'm just looking at the spine right now, and I'm happy that the spine looks pretty darn good for the most part. A little bit of a hot spot there. I think that's my L4 that they were talking about, and then that's the iliac bone on the left side, because in the images it's reversed. So this is the left and this is the right. And then they said there's an SI joint, but I don't see what they're talking about there. So, but it must not be that bad. And there's the bladder, so that's all normal there. A little bit of uptake in the hip area, but I kind of knew that because I've been having right pain in my hip, so that's probably what that is. It's probably related to that, whatever that is. So far, nothing too scary looking. That's just normal. That seems to always happen at the end of the scan. One other thing I was just looking at is also my muscles down here because of my autoimmune disease, and they look fairly symmetrical, so that's good. At least my muscles seem to have recovered from the attack of my autoimmune disease. But there's a little bit of inflammation there, but I'm not too worried about that. Maybe that's what they're talking about right there, the SI joint. It's very, very minor. In the one hip, the iliac bone one, which is right here, you notice that you don't see a dark spot. So it's not eating the bone. It's not completely destroyed the bone there. It very well could be eating the bone, but it's just the evidence isn't as obvious yet. But that's the only bone one that really seems to stick out at me, other than maybe that L4 hot spot there. I'm just going to go up and check the spine again, because the spine's kind of an important part of the body. So, and that's another one of those little hot spots. It's next to the spine there, and another one there. So a lot of this activity is all on the left side, and I feel that that's kind of strange, and it makes me wonder why. But here's the lung, nice and dark, not a lot of funky stuff here. I mean, there's a little bit of glowiness on that side, but overall, I would say it's pretty darn good looking. The lungs are pretty darn good, except for, of course, the pleural effusion, which is not a good thing, but it's not horrible. So, yeah, and then, of course, the lymph nodes. But I'm really curious as to why I have so many lymph nodes just on the left side. I think I have those pop up almost every time. And I'm supposed to have had one in my arm. I think it was my right arm, so it would be over here. I'm just trying to see if there's any evidence of that in here. Yeah, nothing scary looking. Actually, those look really good. Arms look good. Of course, the brain isn't well imaged in PET scan, so they usually do an MRI for that, I believe. But I didn't see any big problems with the bones, except for those two little hot spots, and down the lower part of the body there. So that's awesome. Let's see here. There was one of my scapula. I don't see. Looks like that one's nice and gone. That's good. But so basically, it looks like, if I keep scrolling through this, a lot of the activity happens to do with around the lung. Okay, so if we go back and look in the lung, this is a pleural fluid. This is a fluid that's next to my lung. There's no tumors in this black area. So that's good. That means there's no tumors actually inside the lung material. Okay, same thing on this side here. Now this is normal. These are like little blood vessels. And that happens every time. I see that every time. All right. But you're not seeing like blob, 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 like these blobs. You're not seeing these blobs in here. If you were seeing these bright blobs in the middle of the black blob, I would be really concerned. But I'm not seeing that. So the lungs, the inside of the lungs they look good. The liver looks good. They said the heart was their normal size, so all the major organs look good. But I do have some issue around the lung, and I don't know what's going on with that. It could just be the cancer going through the lung and around. So and that one's probably the biggest it's ever been. That's probably why it's been a little sore lately. But so anyway, that's this PET scan. So you can see again, most of the damage is happening around the left lung. They actually have some notes here, before and after. So this would be, trying to see, can't read, it's too small, 2021. So this is the new, this is the old. So you can see that was there before. All right. So this would be before and after, not much of a change. Here they're talking about this one here. So this is now, and this is before. So you can see that one's hotter than it was before. Yeah, you can actually see that there's that too, and that one's bigger too. And then this is the lymph nodes near the neck. All right, so this is now, this is before. And then this is the other side now, and then before. So you can see there was a little bit of heat, but it wasn't quite as hot. And then they're talking about so there's the subpectoral, and it was quiet before. So, but it had popped up, in previous scans. So it's reactivated. And then this is the iliac bone one. Yeah, that's what they're talking about there. So this is now, and this is before. So it's a little hotter than it was before. All right, and then these guys here. I wonder if these are the para-aortic ones that they were talking about in the report. I'd have to I would have to research that. But you can see that there were some activity there before, but now it's more active. So this indicates that something is going on, and in the lymph nodes. And the only thing that I worry about is lymphoma, because that's something that cancer patients can get from getting cancer treatment is lymphoma. So, but I don't think it's in the right pattern as far as I understand it. Usually if it's lymphoma, I think it's supposed to be more clumped together. But it is clumped around the left lung, so I don't know. It's something I'm going to be asking my doctor. But anyway, overall, yeah, it's not great, but it's not terrible. It's somewhere where I can work with this, right? So, like I said, the spine's pretty damn good. The liver's good. The heart looks fine. My energy's fine. I think my pain that I'm getting on my left side is probably due from these darn lymph nodes that are butting against my spine. So these guys here, and then the ones on the outer part of the ribs here. So yeah, when I took the dexamethasone before I thought I was going to have a chemo, it did help with the pain. So it's definitely, inflammation is definitely happening there, but I don't know if inflammation is the cause of why they are there. But the dexamethasone definitely does reduce the amount of pain I'm experiencing. And I might have to take some more of that today, because it's really bothered me. It kept me up for a good chunk of the night last night. But overall, I'm glad that I don't have anything in my organs, so that's awesome. I'm not happy that there's so many small lymph nodes popping up here. So I'm going to be doing some research so I can ask good questions to my doctor tomorrow. We have a phone visit or video visit, so I'll be asking her, what she thinks is going on here, why it's only on the left side, except for, of course, that one there, and what she recommends, and, what's going to happen. So once I get that phone call done, I'll kind of update you guys. But overall, yeah, I'm a little disappointed that that things have increased compared to the 3 months ago. There's a definitely increase, but it's cancer. It's stage 4. It's going to happen. And I was just hoping it would happen so soon. It hasn't been quite a year since I've done chemo, so, but we've got almost 2 years, so that's, another year of life I've had to be able to enjoy. But anyway, so I'll let you know what's going on with that, and thanks for watching.